Hello again and welcome back to the channel. I'm Dr. Jay Braley, and here I'll be trying to help you through your medical questions and get you a good grasp of what you need to do, when to get an opinion from a doctor or a nurse, and where to go even. In this couple of weeks I was working overtime and it was not merely possible to create content for you, and I had upper respiratory symptoms with a negative COVID PCR test. I even created a Twitter account, but I don't have a clue why it got restricted. Nevertheless, let's get into the video. Imagine a scenario in which your child sleeps on a hard surface, not a mattress or something like that, and the window is open. There is a slight breeze coming through, and it was a hot summer day playing outside. A couple of days later, your child tells you that their throat hurts and it's quite hard and painful to swallow. They're coughing, sneezing, and they have a runny nose, quite a bit of feverish, and complains about the chills. You wonder if it's the flu, common cold, or any other upper respiratory infection. Should you let them go to school? Should you be worried, or what? So what should you do afterwards? I'm here to explain. Without any further lingering about, let's find out. Well, first of all, we have to know that there are myriad sorts of viruses that can cause common cold, but the most common of them all are more than 100 serotypes of rhinoviruses that can cause up to 50% of the common cold. Other viruses like coronaviruses, the COVID-1, which is SARS-CoV-2, influenza viruses, respiratory syncytial viruses, enteroviruses, and others can also cause common colds. Because there are a lot of viruses that can cause common colds, people can get common colds multiple times a year. Children younger than 6 can average 6 to 8 colds a year, with symptoms lasting more than 14 days. Think of it this way, that a child younger than 6 can get one cold a month through September to April, and they can have colds half of this time period. Well, it's cold to cold, but it doesn't have to be cold to catch a cold. So colds are not caught in the cold and are not caused by the cold. It's merely a viral infection, and it's mostly transmitted person to person, with preventive measures like hand washing, mask wearing, seen in this pandemic that we're in, and in the lockdown of the COVID, we can slow the common cold as well. Colds are transmitted person to person, either by direct contact or by contacting the virus in the environment. Viruses live in the upper respiratory mucus, and people with cold usually carry the viruses on their hands. They can transmit the virus to the surfaces, which the viruses can live up to 1 day. If the virus gets to the eye, nose, and mouth of another person, he or she can get infected. Cold viruses usually don't spread through saliva and phlegm, but it doesn't mean that children with cold can go out spitting about. Droplets containing viruses can get exhaled through coughing and sneezing, and everyone should cover their mouth and nose when doing so. The signs and symptoms of a typical common cold starts 1 or 2 days after exposure. Nasal congestion, fever, and colored or clear nasal discharge are common during the first 3 days of the illness. Other symptoms can be sore throat, cough, irritability, decreased appetite, and so on. Symptoms usually subside in the first 10 days of the illness, but some children may have symptoms well over 10 days. It's not even unusual for children to develop a second cold after symptoms of the first cold are resolving, which can seem like the child has caught one single cold for weeks or even months. As I said, COVID virus or SARS-CoV-2 can cause symptoms like common cold. First of all, this virus does not cause COVID-19 all the time. It can cause symptoms like common cold that we all know. Its symptoms of the common cold typically begin 4 to 6 days after exposure, but may occur even 14 days after the exposure. In most children, symptoms include fever and a non-productive cough, although runny nose, abdominal pain, vomiting, or diarrhea can also be seen. COVID-19 itself in children can be mild or asymptomatic. Severe infections, hospitalization, or even death are so much less in children than in adults. As I mentioned before, unfortunately, cold caused by SARS-CoV-2 in a child looks like a typical common cold, and the SARS-CoV-2 can only be diagnosed with a COVID-19 test and a PCR. So it's better to find out whether or not the child has a common cold caused by SARS-CoV-2 or a typical common cold, so it can help reduce the spread of the COVID-19 disease. Yep, common colds do have complications and they can be serious. We can see bacterial or viral ear infection and pneumonia with an early onset fever after resolving of the first fever, and the pneumonia only with rapid breathing and a new cough as well, exacerbating or newly onset asthma. It can cause asthma, but it can bring it up and make it visible. Bacterial sinusitis can be one of the complications if the nasal congestion doesn't get better after 10 days with deep headache in the middle of the face. There are some SARS-CoV-2 specific complications which are quite rare but can get serious, can be life-threatening even. MISC or multisystem inflammatory syndrome of children, which is quite serious and life-threatening, characterized by inflammation of the heart, the lungs, kidneys and other organs. Affected children may appear feverish and ill. They may also have abdominal pain, vomiting, diarrhea, rash or bloodshot eyes. These children should be taken to the emergency room immediately. Myocarditis and pericarditis can also occur in children and may also pronounce lethal for children. Exercising can lead to abnormal heart rhythm, and that can cause SCDS, sudden cardiac death syndrome. It's best for children to be examined before returning to exercising and sports. Well, it's different from the colds of the adults. Antihistamines, decongestants, cough medicines, and expectorants alone and in combination aren't used in infants and children because they're not approved, and the FDA has recommended against using them in children younger than 6. Even in children older than 6, there have not been any proven benefits. For the first few days of cold and for their fever, you can give acetaminophen to your child older than 3 months, and you can give them ibuprofen for older than 6 months. Aspirin is not allowed for people younger than 18 years old because of the probability of dry syndrome. Humidified air may improve symptoms of nasal congestion and runny nose. You can use nasal saline drops or sprays depending on the age of the child to thin the nasal mucus and treat the nasal congestion and runny nose. Honey may be helpful for nighttime cough in children older than 12 months. If your child is younger than 1 year old, don't give them honey because of the risk of the botulism. Antibiotics aren't effective in treating colds, and using them inappropriately can cause resistance. They may be necessary for the complications. If you suspect complications like pneumonia, ear infection and so on, seek medical attention. Encourage your child to drink sufficient amount of fluids. If because of decreased appetite they cannot drink or eat for a prolonged amount of time, seek medical attention as well. There is no proven herbal or alternative treatment for the cold, but vitamin C may decrease the duration of the cold because of the slight boost in the immune system. Simple hygiene: thorough hand washing with water and soap, hand rubbing with alcohol-based sanitizers only if a sink isn't available, and keep your child's immunizations up to date. Teach your child to cover their nose and mouth when coughing and sneezing with a tissue and dispose it in a hygienic manner. Isolate those with known or suspected COVID-19 infection until at least 10 days after the symptoms or 24 hours after their fever has diminished. Staying in separate rooms, using separate bathrooms, not sharing cups, towels and culinary items, wearing masks if there is no possibility for using separate bathrooms is mandatory, and it's better not to attend to school or daycare for 10 days. If the child with cold refuses to drink anything for prolonged time, has behavioral changes, behaves oddly, is irritable or easily annoyed, and has difficulty breathing, works hard to breathe, or does breathing rapidly, call your health care provider ASAP. Call your doctor or nurse if your child has a fever greater than 38.4 degrees Celsius for more than 3 days, has worsening nasal congestion, eye redness or with yellow discharge, or there are signs of ear infection like ear pain, ear pulling, and so on. And if your child is an athlete and has a known or suspected COVID-19 infection, he or she should be evaluated by a doctor before returning to sports. So that is all from me. Don't forget that the SARS-CoV-2 virus can cause common cold in children, so don't forget to get the shot if you haven't. Don't forget to like, comment, and subscribe to the channel for more medical content. I had a personal encounter with upper respiratory symptoms which held me from creating content for this channel, so learn from my misfortune and take care. Stay safe and healthy. I'm thinking about doing some book reviews as well, as I have read some quality books in the past month. So comment your preferred books for me to read and review. Take care. Bye.